Does PRP with microneedling really work like a facelift? Is it true that it has a filler effect and that it improves skin quality and sagging? I am considering doing it, but I do not want to waste cash on snake oil.
Thank you for your question. You're asking if PRP and microneedling works as well as a facelift, and that in your research you found that it improves skin quality and improves tightening the skin, and you want to go ahead and consider this, but you also don't want to waste money on something that won't work. Well, I can certainly offer you my perspective. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I've been doing facelifts, eyelid rejuvenation, and full-body cosmetic surgery throughout this time, as well as the full offering of injectables and lasers and non-surgical options, and including PRP, which is a very big part of what we do. And we've even gone so far as develop a way to help people with pattern loss, both men and women, using PRP combined with acellular matrix. So to simplify the answer to your question, the answer is PRP and microneedling will not in any way replace the effect of a facelift. I think that unfortunately the terminology and the way it's a lot of medical treatments, and not specifically just this, are promoted. Very often people who are averse to having surgery are looking for the holy grail of the non-surgical option that will allow them to get surgical results without surgery. Well, there's a reason why surgeons like myself go to work every day in operating rooms doing surgery, and it's because you cannot replace a facelift with a non-surgical option. And we, in our practice, we actually have the technologies for both with the PRP, microneedling, non-surgical skin tightening using radiofrequency, non-surgical skin tightening using lasers, erbium, ND-YAG, fractional CO2 laser. There's nothing we really don't have in our practice to help our patients look their best. What you have to distinguish essentially is the differentiation between skin quality and skin quantity. Just as I would go as far as to say you cannot replace things that you can do for the skin with a facelift, the same goes the other way. Back in the mid-90s, when the original CO2 lasers were introduced, people were saying, oh, well, if you tighten the skin well enough, you don't need to do facelifts. Well, that didn't work out as anticipated, because you can only tighten the skin so much through thermal energy. And the reason why I have all these modalities in my practice, that even as a surgeon who performs a lot of facelifting surgery, I also incorporate a plan of skin rejuvenation that does include PRP, that does include lasers. It's really about, it's like cooking. You're putting the right ingredients in the right way, and you're trying to get the best result. So when people often spend tremendous amounts of time, money, and resources trying to avoid a procedure when really the best thing to do is to get the actual procedure. I find this very commonly with people who come to me to who need help with bags under their eyes. It's the same exact story. They very often will look for something that's, quote, non-surgical, including injectables, and then they come to me to have it kind of undone and then have the definitive procedure. Now, the fact that you're asking a question is fantastic. It's all about creating a dialogue and reaching out to experts to help you learn about these things, and particularly people who don't have a bias. As a specialist, as someone who offers all these modalities, I can do anything in my practice, and I'm not limited by training or by resources. So certainly if you want to improve skin quality, that's fine. But if the dominant feature, and I always try to help my patients understand this, people come to me, they don't just come for a procedure, they come for guidance in what they should do to maximize their result based on their priorities. So I always ask them, what is most important to you? Where does your eye go when you look in the mirror? And in your case, I suspect, even though you didn't submit a photo, your eye probably goes to sagging skin and jowls, which means that the right procedure is some type of facelifting procedure. So I recommend you meet with qualified, experienced cosmetic surgeons and learn about your options. In our practice, we do these procedures under local anesthesia with light sedation. Our patients recover very quickly. We use platelet-rich plasma as well as acellular matrix to optimize wound healing and to get people looking good. We don't use drains. We do a lot of things to try to make this as close to non-surgical, but it still is surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.